I'm Lesley Gilchrist, midwife and co-founder at MyExpert Midwife.
And I'm McEwen, consultant midwife at MyExpert Midwife.
Now, you may remember us from Channel 4's One Born Every Minute, and that was a few years ago now. Today, we're going to talk about breastfeeding, positions, problems that you may encounter, and this is the third video now in a series of 5 all about breastfeeding.
So what we want to talk about is sometimes you get soreness, cracks or bleeding nipples with breastfeeding, and it can be really quite challenging when you're starting your breastfeeding journey. So one of the main problems is around crack, sore and bleeding nipples is your latch and attachment. So we're going to go through a few things that you should be looking out for and a few things that you shouldn't be seeing when you're feeding your baby.
Now, don't be frightened. This doesn't mean that every single person that tries to breastfeed is going to get cracked or bleeding, sore, painful nipples. What we're talking about are problems that happen because you don't have that positioning or attachment quite right. And the fundamental thing here is get help straight away. So that first time you attach your baby to your breast, get your midwife or your health visitor or whoever is around that specialises in breastfeeding, get them to make sure that positioning and attachment's right. Because if you get it right from the start, you shouldn't run into any problems.
So what do you think we should really be telling women to look out for when they're feeding their baby?
You see, I always worried that we would put women off breastfeeding, by telling them that, it can be painful, there can be problems that you run into. But equally, I think women do need to know that they may run into these problems because they need to know how to prevent them, or at least how to solve them.
And that it will be okay.
Well, that's it.
It's they're not problems that you can't get over.
Absolutely. And, it's that first week, it's almost just that you're getting used to it. You're getting used to each other and, you're tired or you're recovering from childbirth as well. So that's usually that first week. It's a bit of a struggle. Get the help that you need, all that support that you need, get that in place. Do your homework as well antenatally. So in pregnancy, go along to every breastfeeding clinic that you can find and learn about that positioning. And because if you can crack that, you're very unlikely to run into problems.
And just watching other people breastfeed, I think
definitely.
is just absolutely, really helpful to your own breastfeeding journey.
And I think as well, they don't quite realise that there are even private practitioners, so breastfeeding consultants, lactation consultants that are pretty much, it's like having a degree in breastfeeding. That's how well trained and educated they are, the lactation consultants. And, a lot of them have private practices, do a search on the internet and you'll find lactation consultants that will come to your home. They will charge a fee. But certainly if you don't feel comfortable going out to a cafe, then certainly, just get them to come to your home. Likewise, the NHS should really have that provision to be able to send staff out to support mums at home. But they don't always have the time, and I think that's a problem. I think when we both worked in the NHS that we ran into was that the time. You just don't quite have that time that you would really want to have.
If you can get out to a baby cafe, there's quite a lot around locally, then please do that. So what should we look out for regarding when baby goes onto the breast?
So I think it's that position. So even before they're on the breast or going to the breast, it's making sure that their head and their neck and their back are in a line. Because if you've got your head twisted to the side and you're trying to feed, it's just not that optimum angle. So you want to make sure that your baby's in a nice neutral position, that their head's in line with their back, and that they're comfortable as well. So even just that slight turn will make them uncomfortable. You want them comfortable on your breast. So Karen, what we can see with baby is that they're in a nice straight line. So their head, their back, and everything's in alignment. And this C that you can form with your thumb and your forefinger, just either side of the neck. And that just helps to support your baby's head, but without limiting the movement that they can have to come off and on the breast themselves.
Because your baby has quite good neck control, really, doesn't it? And head control. So, you know, they're quite able to hold their heads, where people seem to think that, you know, babies don't, and, you know, they need that support on the head. They don't. They just need their neck supporting here so they can remain in a straight line. And it can be one-handed, can't it?
Absolutely, and I think it's important.
You've got
because
hand free here.
Yeah. You need to drink as well, don't you? You need to be able to take on as much water as you feel, you know, your thirst requires. And I think once you start, and if you get...
And you will be thirsty. You start to become thirsty, don't you, as you're feeding. So be prepared with snacks and drinks when you're feeding. And
remember, this doll doesn't have this motion that babies do with their hands. And you feel like sometimes you need 3 hands. And it may be just these first few times you do need someone else just to help get this hand out of the way, because what they tend to want to do is actually suck their own hands. So you almost just need someone to gently just keep baby's hand out the way. And you should, depending on the size of your breast tissue, you should be able to gently just pop baby to the breast, and you're waiting for that extension of their mouth. You're waiting for their jaw to be wide open, and it's that timing. You don't want to wait until it's sort of closing, because there's not enough room to get the breast tissue that you need in. And if you imagine this part of the nipple, this is what women find really sore. And if you imagine that this is the roof of baby's mouth, the palate, their hard palate, if their mouth's quite closed as you're popping your baby onto your breast, that nipple actually ends up rubbing against that hard palate, and that's where you get the sore nipples, the cracked nipples.
Yeah.
And babies having to suck then, so they're not able to compress that breast tissue to squirt the milk out. They're actually having to suck to get the milk out of your nipple. So with the baby's mouth wide open, and it is timing, you literally just have to shove baby on when it's at that perfect moment, don't
and baby's nose should be close to the nipple, just so it can just reach out when it's got a wide mouth and get onto the breast.
So you almost want their nose just touching the tip of the nipple, and that is enough for them to search for it. And as they search, they'll open their mouth, and you literally just want that mouth wide open, and it just to come over the top of the nipple. And you can see just by that the nipple is now at the back of the baby's mouth in the soft palate. And what then happens is your baby's using their tongue to squeeze the breast against the palate, and that's what's happening. So it's actually squeezing all the milk ducts there that are holding that milk, and then the milk is literally squirting to the back of their mouth.
And it can feel quite powerful, can't it?
I mean, it's quite a bit of suction.
I remember doing it myself, and it was quite a powerful feeling. So it should feel like a strong suction that the baby is doing, but you shouldn't be feeling that pain, and certainly not after a few seconds.
No, and I think
that pain might be there, but then it will just
that's
disappear.
letdown.
Yeah,
we talk about letdown a lot, and it's like some women will describe it as toe curling, just for maybe 5-10 seconds, and then it eases straight off. But you will feel like a suction, and you will feel that there's something being removed from your breast, but it shouldn't feel painful. If you do find that your nipple is painful, or there's any pain at all during that feed, certainly after that first 10 seconds, you need to be getting support. You need to be getting someone to come in and look at how you're actually getting your baby onto the breast.
So what about other positions, Lesley? Do you think that, because that's a traditional sort of cradle position, isn't it there?
I think
there are different ones, aren't there? Like the lying down position, which we can demonstrate how to do.
And that's brilliant on a morning, isn't it? When you just, you just feel like you just need that rest.
Or if your perineum is sore, or you have cesarean section scar, then obviously lying down is going to take the weight off that as well.
And I think as well, when you've just given birth, your womb's still quite bulky.
Yeah.
So you do still quite a bit of a tummy, and it's sometimes difficult, especially after a caesarean section, when you're more reclined back, to try and find that great position. I always found my children had a preference. They always preferred one boob.
Yeah.
And there's some evidence as well that one boob will produce maybe up to 20% more milk as well. You've almost got to
Yeah.
fool your baby, don't you, into thinking that they know that one boob's maybe producing quicker milk. And that's rugby ball. I used to always have to use the rugby ball to sort of fool them into thinking
like this.
that they were on that same boob.
Yeah.
Otherwise, they would fuss at that boob
So
because
under
they
your
wanted
arm.
to. Yeah.
Yeah.
And you can see it's exactly the same. So if a baby preferred the right breast, then they would be fooled. If they preferred the left breast, they could be fooled into thinking they were still going onto the left breast by using that position.
I've also seen women feed upright with a baby. So you can actually sit your baby. Again, it's a straight back, isn't it? The straight neck. Obviously, your baby does need that support again behind it here. So hold it by the neck. And then they can actually feed upright.
Yeah.
So it really is, what is, the best position that you find that suits you and your baby.
That's it, definitely. So what are we hearing then? So if we know what we're seeing looks like a good position, once we get the attachment right, there's certain things that we would always look out for that we know is good attachment, and that we know that there's good milk transfer, so the baby's being able to get milk from the breast.
So you need to see that the baby's chin is really quite far down, and you can see that there's that motion that you were describing then going on, and also you shouldn't be seeing much of the actual what we call the areola.
So this darker brown patch, you shouldn't really be seeing that at all. You almost see that the lips are curled outwards as well. Yeah, you shouldn't hear any sucking or clicking noises. It should be quite quiet. You might see your baby swallowing, so that'll be something that you'll be able to see. And you might even hear the milk going down the throat, but there shouldn't be any audible clicking noises, because that means that the attachment isn't quite perfect. Now, with the jaw, the anatomy of the jaw, when we were talking about a baby with a good position and attachment, they will be squeezing that breast tissue between their tongue and the roof of their mouth, and that jaw movement, what you'll see is just that ear moving. If your baby's latched onto your nipple and is sucking, what you'll see, because they don't have enough breast tissue in their mouth to plump out their cheeks, what you see is their cheeks suck in, because they're having to create that negative pressure in their mouth to draw out the milk. So again, you want to see ear movement, but no sucking in of cheeks. So at the start we talked about soreness, pain, sort of cracked nipples, sometimes they may bleed. And then we looked at the different positions and attachment to make sure that you can avoid that happening. It's not always the case. Sometimes when you're really tired in the middle of the night, you literally are just thinking, just please go on and feed because I want to get back to sleep. And then sometimes it just takes that one feed just to give, it's like a friction burn. And that can be quite sore, can't it? Just with the saliva from their mouth. What you should be looking for with your nipple is that it shouldn't be, when it comes out of your baby's mouth, it shouldn't be scrunched up. Call it like a lipstick, that angle. So it should be looking like it's been flattened in your baby's mouth. So that's what it should look like when, your baby comes off after finishing a feed. But it shouldn't have one side sort of flat, because that tells you that it's been flattened because it's been on the roof of their hard palate. So soreness then, I was always taught breast milk. Squeeze a little bit of breast milk, just express a little bit off and around your breast nipples. Milk can be absolutely great for sore nipples. So you can express a little bit off and you can just rub it around the nipple and the sore bits, wherever it is sore there. But sometimes I feel as though women are telling us that that's not enough, and their nipples really are cracked, sore and bleeding. Yeah. So in that case, I would always recommend that you get a lanolin based nipple cream. Yeah. I think it's the closer that you can get to a natural product, to nature, and what nature uses for that purpose, which is as a barrier, a moisture, keep moisture in, and it does just help prevent. And lanolin is the closest, isn't it, to human skin oils? Absolutely. Of most creams and barriers that you can get in nipple creams. It also needs to be quite smooth, so you want it to
go on really smoothly.
Yeah.
You don't want a thick substance that's going to cause any more damage or, you know, cause the skin to be more sore than what it already is.
I think some of the pure lanolin creams, they do just need softened on the radiator or in your hand, and that will just take it to that consistency that you need. You might need to experiment with a few different creams just to find the one that works best for you.
And it shouldn't take more than a few days, should it?
No, certainly not.
So once you've had your latch and attachment checked, you've tried a bit of breast milk on your nipples. If that hasn't worked, try some creams on it. And if after a few days that still hasn't worked, you need to be having a rethink, going back to, you know, the latch and attachment and getting somebody to come and really take a good look at what's going on.
It is that getting that professional help, and getting that professional help as soon as you think you need it, rather than waiting and delaying. Because there's just something not quite right there. If you're having soreness that's persisting, there's just something that's just not quite right.
Yeah.
So thanks for joining us. If you would like us to talk about anything else, just pop it down in the comments box below. And like, share and subscribe. And we'll see you next week. Bye.